Good morning, Artin.
Morning, Jacques.
Thanks for coming in.
Thank you for having
Hi,
me.
guys.
Appreciate you.
Appreciate you too. So it's been a minute since we've made a YouTube video. Artin was kind enough to volunteer. Artin, what's going on? What's your hair loss journey been like?
Well, honestly, I never thought I was gonna need a hair transplant. When I was like, I really had good hair all my life until I really started losing hair around like my mid-20s, like around 25, and I'm like, wow, this can't be the way. And honestly, I'm just really happy to be here right now.
For Artin, we're doing 3,000 to 3,200 to restore the first half, basically up to where it meets to zone 3. So hairline, zone 1 and zone 2. It's going to look amazing. His donor region is fantastic. We're going to focus on the corners and add density here in the center. So what we're going to do next, guys, is we are going to remove the pillows. We're going to shave the donor region. We're going to keep the hairs on top long. We're going to extract. So the procedure has 4 phases. Right now we're going to start with phase 1, which basically is the extraction process of the 3,000 to 3,200 grafts. All right? All right, Artin, we're just going to outline your donor region. You have super high density back here, so your outcome should look fantastic. Artin, what does family and friends think about your procedure?
It's a secret.
It's just, you haven't told much?
Nah, just Susie knows and her family and my mom.
All right, Artin, now that we did the shave of the donor, I'm going to outline your donor region using a surgical marker, okay? So the reason for this is we want to make sure we extract the same number of grafts per square that we're targeting the 3,000 to 3,200 for you. So everything once is grown out looks nice and even and balanced, and not one area is overly harvested, okay? But more balanced and looks natural.
Amazing.
And normal. All right, Artin, this is a portion that's going to be a little bit sensitive, okay? You're going to feel a few seconds of pokes on this right temple, the upper portion, left side, upper portion, okay?
Okay.
You're almost done. 3, 2, and 1. You did it. Good job. All done. You're doing fantastic, by the way.
Thank you.
Here we go. Upper portion. 1, 2, 3. You're doing amazing. Almost done. 3, 2, and 1. Last one. You did it. Good job. Congratulations. The rest is going to be super duper easy, okay? Good job, Artin. We're going to get you in position, and we're going to start the extraction, which is the removal of the 3,000 grafts. Worst part is behind you. Everything else moving forward is very straightforward.
Thank you. Thank you.
You did amazing.
Appreciate you guys.
Of course.
So any little movement is big for them, okay?
Here we go. You should not feel a thing. You're doing good?
Yes.
Amazing. We're about 75% done, buddy. We're just extracting. You have amazing quality follicles, grafts. They're popping out amazingly. Okay, and we'll be done here in about maybe half an hour or so.
Perfect.
Here's a nice follicle. If you look at that, that one has 3 hairs in a single graft. So that's a triple. So this will give 3 hairs in a single follicle. So we're done with the first phase.
Okay.
Okay. First phase was what? Extraction. Now we're going to do phase 2. What's phase 2? Design. Okay. So we were aiming for anywhere from 3,000 to 3,200 grafts. What did we end up with?
3,076 grafts.
3,000. Okay, we got almost 3,100. I think that's plenty for what you need.
Okay.
And I believe you have over 70% doubles and triples.
Oh, wow.
Okay.
That's amazing.
So you have almost equal amounts of doubles and triples, and then barely enough for the singles for the hairline. So you should get amazing looking density. So what we're going to do now is give you a nice looking hairline, something that's going to look natural moving forward, not what you had when you were 15, 16 years old.
Okay.
That's going to complement the facial features, where the focus now is the eyes, not the forehead or the chin. Okay. Almost 15. Half of that is 7.5. your hairline is at 6.5. So basically, the placement of your hairline, we should not go any lower. Why? Look at your distance from chin to eyebrow. Do you see how that's almost 15 centimeters?
Yeah.
Okay, so if this is 15, to break it down, this is telling me this is 7.5, this is 7.5, together I have 15.
Okay.
Perfect location to place a hairline to break the face equally would be from the eyebrows up at 7.5. Does that make sense?
Yeah.
Why? It gives you equal symmetry.
Equal
Okay.
symmetry. Okay.
But if I look at your existing hairline right now, it's actually at 6.5.
Okay.
Which means it's already super low. We don't want to go any lower than that. So we want to keep it where it is.
Okay.
Does that make sense?
Yeah.
Otherwise, your lower portion of the face is going to look too exaggerated and too long. Chin up a bit. Raise the eyebrows. Relax it. Close the eyes. Bring your chin down a bit. So basically, we're going to trace the existing hairline that you have. And the hairline you showed me this morning. You don't want to place the hairline, raise the eyebrows. That goes on the part of the skin that wrinkles. Technically, it's supposed to go a little bit higher up as well. You see that?
Yeah.
So I know you wanted something that is more youthful, so I'm doing more of the aggressive. But technically, if you look at it, that can also be a placement. But I'm giving it to you the lowest within the safe border.
Okay.
How she feels.
How do you feel, Susie?
I think it's
I feel
good.
good.
Is it the? I'm sorry. Is it the hairline that you want?
Yeah.
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 It's more aggressive than Baja's though. I can tell, right? Or
Yeah.
no?
It's pretty similar.
Yeah.
It's there. His dimensions are slightly different.
He is right because your forehead is a little bit smaller,
Yeah.
right?
So excited.
All right.
This is excited. Order up. All right. There's one little thing we didn't let you know. I'm actually gonna be the one that does the extra, whatever they're doing.
Make sure you wash your hands first before anything.
Listen, you don't worry about that. All right. Who worries about it is me.
Okay.
Your hair will turn out fine. I'm gonna be the one that does it.
Okay.
So, let's kick it.
All right. I believe in you.
Thank you.
We have the skills of what it takes.
How's that?
See? You gave him Mickey Mouse hairline.
Is it really?
Yes.
That actually looks great.
It's lopsided.
What?
But
Just walk quick, nobody will notice.
right. So I'm not done with the hairline yet. I'm gonna tweak it a little bit.
Okay.
Okay. The right side and the left side should look similar but not identical.
Okay.
Okay. So we want some asymmetry. I can't trace over the pre-existing hair, so I'm going to shave it first and then go over. This is your hairline. That's going to drop and connect to your temples. This is your zone 1. Zone 1 is the first 2 centimeters. So if you look at that, that says 0, 1, and 2. Do you see that?
Yes.
Okay, so first 2 centimeters, 0, 1, and 2. And from the center to your temple connects at 7.5. 7.5. Typically it's 8, so you have a smaller dimension. So when I multiply 2 times 7.5, I have a total surface area that is what? 15. What I did here, 2 going back, 7.5 connecting to your temple is 15. 15 and 15, I have 30. Okay? So your total surface area for zone 1 is 30 centimeters squared. Natural density per square starts 70 to 100 grafts, so this has to look natural looking density. So we put at least 70 grafts in every single one of the 15 squares. So when you have the total surface area that's 30 with the minimum natural density 70 grafts, that's 2100 grafts. That's going to go alone just in your zone 1.
Okay.
Then you have zone 2, which is the following 5 centimeters right here. That's what we're going to focus is your zone 1, zone 2 today. You have half the density, you're missing the other half density. So here, we can't do natural density like we did in zone 1 just because everyone has a limited donor. But in zone 2, we use half of natural, which is 35 grafts, okay?
Okay.
Typically, the surface area here is 35, so the two together, 1225. So if you were completely bald, about 3,300 grafts is what it would have used. So for you, we have almost 3,100. Okay.
Okay.
3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3,100. 3, You can stop this. Now that I shaved it, it's easier for us to outline the hairline. We're gonna clean up the lines and we're gonna trace it with a surgical marker, okay? So guess what? You're halfway done today.
Thank you. Yeah.
You see?
Yeah.
Not that bad, right?
Yeah.
Look down a bit. Look up a bit. Close the eyes. Artin, here we go.
Wow.
Brand new hairline. Okay. What do you think?
I love the hairline.
You love it?
Yeah.
You see how it's almost similar but not 100% identical?
Yes.
That's what we want for a natural looking hairline. Okay. Susie, what do you think?
It's nice.
So now we're going to move on to the third phase. Okay. Third phase is I have to make the tiny little pokes on top.
Okay.
Okay. You're going to get a few seconds of injections on the right and left eyebrow. That's going to numb about 75-80% of the scalp. It's a little sensitive, but it's nothing you can't handle. You did perfectly today. Okay.
Thank you.
You're going to get an injection here, 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 and here. Okay. So by the time you say ouch, it's already done. I'm going to palpate for the trochlear nerve. Okay. And the orbital nerve. There you go. 1, 2, and 3. Don't move. Don't move. That's it. You did it. You see how fast that is? Here comes the second one. Don't move. 1, 2, and 3. Right side's all done. Good job. 1, 2, and 3. Here we go. Perfect. And here comes the second one. Don't move. 1, 2, and 3. You did it. Good job. This is the most sensitive, and you took it like a champ. Alrighty. We're going to get started. Don't move. Here we go. 1, 2, and 3. We're working on the hairline, okay? You should not feel a thing. This is where I follow your natural angles and directions.
Yeah, I don't feel anything at all.
Good. A lot of clients do take a nap, so if that's something you want to do, feel free.
What I'm doing now is finishing up the blood draw for the PRP. We use PRP during the transplant to help boost the survival rate. That's the most important aspect of doing PRP when it comes to the hair transplant itself. But we also get faster healing times and sooner growth. So the timeline for a hair transplant growth is typically around 50% growth at around 6 months and about 100% growth at 14 to 16 months. So that can be expedited by doing some of these supplemental procedures at the time of transplant. Don't move your head, Archie, okay? Beautiful. So we're going to take this blood, centrifuge it, concentrate those growth factors, and then inject it into the areas that we're working on now.
This is going to be the hairline that's going to be with you for the rest of your life.
Wow. This looks amazing.
This is going to come down next few days like that. Okay?
This looks...
This is all puffiness. You see this?
Yeah.
All of this is puffiness. Brand new hairline. It's jagged. It's zigzag. It's not a perfectly flat, straight hairline. Right and the left are pretty similar. They're not identical. We actually had about 200 extra follicles. You went a little bit further into zone 3.
Wow. I really like it. I really love it.
You like it?
Yeah.
I love it too. Let me see. So good. This is going to come down. This is going to come down. Look how awesome that is.
That's perfect.
Something totally different. Birthday party for Josh, and I'll never forget the surprise party Drake planned for my birthday. When he walked in, we all dealt with time. I just wasn't expecting to be surprised by all those people in our room. Josh was so shocked he pulled a punch and nailed our Aunt Barbara right in the jaw.
Artin, you're done.
I can't believe it.
You did it. You survived.
Yeah.
You got 3,100 grafts for your zone 1, zone 2. Since your features were a little bit more compact, we actually were able to go a little bit also in parts of zone 3, okay?
Thank you.
What you're going to see now is it's swollen. You have fluid in the scalp. So the hairline has risen, okay?
Okay.
Next 3 to 5 days, the hairline will drop,
Okay.
okay? So that's when you get to see where the actual hairline is and will be
is in the next few days.
Okay.
Okay, so I just did a nice wash. We'll go over the post-op instructions in my office of how you take care of tonight, what you have to do, what medications to take. All right, here's a sneak peek. I hope you like it because it's going to be with you
Forever.
forever.
Wow. This looks amazing.
It's going to come down next few days. It's going to come down to here like that. Okay, you see that? It's all swollen.
Yeah.
Okay.
Yeah.
We did a nice wash for you, and
I'm so happy.
I'm excited for you.
I'm so happy. Thank you so much.
You happy?
Yeah. I had a
100%?
100%.
Okay, cool.